Have your partner supine on the mat table with his arm at his side and the forearm in neutral. Place a rolled towel under the elbow to elevate the arm. Have your partner keep his elbow extended to measure. Range of motion. Axis of rotation is lateral epicondyle of the humerus. The stationary arm is the lateral midline of the humerus, and the mobile arm is the radial styloid process. Partner received for range of motion 0 degrees. Normal range of motion is 0 degrees.
You're good.
Have your partner lie supine on the mat, flexing his hip to 90 degrees and flexing his knee to maximum knee flexion. The axis of rotation is placed over the lateral epicondyle of the femur. The stationary arm is aligned on the side to the greater trochanter, and the mobile arm is aligned with the lateral malleolus. Partner received for range of motion 125 degrees. However, normal range of motion is 140 degrees. Have your partner sit with his head in a neutral position. Palpate the spinous process of the first thoracic vertebrae, also known as T1. Place one inclinometer over it, zeroing the dial by rotating it until the arrow points to the edge of the fluid bubble. Place the other inclinometer on the top of the skull, zeroing the dial so the arrow points to the edge of the fluid bubble. Have your partner flex forward and record the measurement of each inclinometer. The range of motion is the difference between the two inclinometers. Partner received for range of motion 45 degrees. However, normal range of motion is 50 degrees.
Start.
Have your partner sit on the side of the mat table with his arms at his sides. Stand behind your partner with both hands on the tops of his shoulders. Instruct your partner to shrug his shoulders, assess available range of motion, give resistance in a downward direction. 5 is considered normal, and partner received a 5.
Start.
Have your partner lie on his side with the test leg on the bottom. Abduct your partner's top leg 25 degrees and use one to assist him in holding it in the air. Assess his range of motion by having him adduct his bottom leg, performing hip adduction. Place your other hand just above the knee on the distal thigh and apply resistance downward. 5 is considered normal, and partner received a 5. Have your partner lie prone on the mat table with his hands clasped behind his head and his trunk off the edge of the mat table to the mid-pectoral level. Stabilize his lower extremities by holding his ankles down throughout the entire test. Have your partner extend up to the horizontal level. A grade 5 is given to someone who can extend his or her thoracic spine and hold motion without showing signs of fatigue or dropping towards the mat table. Partner received a grade 5.